working on my nunchuck skills. Hi, this is Mark Bryan here at Fitness4Life PT.com.
So the next joint we're going to tackle is knees. See a lot of knee replacements, a lot of meniscal surgeries. So again, we're going to caution you to what kind of surgery are you going to have? Because a total knee replacement, most of the time people are in a whole lot more pain than they're going to be if you are getting a meniscus repair. So let's go the hardest one, which would be a total knee replacement, because this is one that we do get patients on from the physicians. And so again, first priority is maintaining range of motion, because when we get a patient after a surgery, so many times the range of motion bending and straightening their knee is very limited. And if you can maintain that range of motion, it's been shown that you don't lose as much range of motion after the surgery if you've maintained it prior to the surgery. So again, we're going to caution you, depending on your pain and tolerance, this is not to see how hard you can go or how much pain you can create. You want to keep it as comfortable as you can. Remember, you don't want your brain perceiving these motions as a threat. If you make it hurt too much, it'll shut it down because it's trying to protect the joint. So one thing a person can do is pedaling on an exercise bike. If they're comfortable with it, it'd be a very low load. But if you can do that, just pumping blood and moving, excellent tool if you have access to that. Another one we really like, we call a heel slide. Okay, and so you use a band. We'll put this band around his foot. He just needs a surface he can slide on, and then to work on the bend, he can get help from the band so he'll slide his knee back on his own with some assistance from the band. Then, if you can tolerate it, you can get a little bit of strengthening, straighten the leg by keeping the tension on the band and straightening it.
Ooh, that's good.
Okay, so nice and easy reps. Do not force it. Always, you never get in trouble if you move slower as opposed to faster. So keep it comfortable, but this is a great way to work on keeping the knee range of motion. A second part you can do too is for the hamstring. In a straight leg raise, use your band and just help pull your leg up somewhere you can tolerate it and back down. Again, if the resistance is too much, you can just use a strap that has no resistance on it and just get the help you need. Always go for whatever's most comfortable. But these are just a couple simple exercises you can do for maintaining range of motion before your surgery. Questions? Contact us at Fitness4LifePT.com.